In this video, you will learn about congenital hypothyroidism, its clinical manifestations, diagnosis, treatment, and so on. Congenital hypothyroidism is one of the most common causes of preventable intellectual disability. Most cases are due to thyroid dysgenesis, that is, agenesis, hypoplasia, or ectopy, and iodine deficiency is a common cause in areas endemic for iodine deficiency. Clinical manifestations of congenital hypothyroidism. Neonates initially have no symptoms due to the presence of maternal thyroxine, T4, from the transplacental transfer. T4 is responsible for the stimulation of protein synthesis as well as carbohydrate and lipid catabolism in many cells. As maternal T4 wanes, metabolism is impaired and marked by a slowing of physical and mental activity, that is, lethargy, poor feeding, constipation, hypotonia. Accumulation of matrix substances cutaneously and internally results in non-pitting edema, example, puffy face, umbilical hernia, protruding tongue, and a large anterior fontanelle. In addition, T4 is essential for normal brain development and myelination during early life, and infants are at risk of severe and irreversible intellectual disability. If a newborn has clinical manifestations of congenital hypothyroidism along with goiter, one of the causes is the transplacental passage of maternal antithyroid medications like propylthiouracil, methimazole, etc. Diagnosis of congenital hypothyroidism. Diagnosis can be made through newborn screening for hypothyroidism. In thyroid function test, an increase in TSH level and a decrease in thyroxine levels are diagnostic. If maternal antibody-mediated hypothyroidism is suspected, maternal and neonatal antithyroid antibodies may confirm the diagnosis. Such antibodies are an uncommon cause of congenital hypothyroidism. Treatment. The mainstay in the treatment of congenital hypothyroidism is early diagnosis and thyroid hormone replacement, which is oral levothyroxine. Initial dosages of 10 to 15 microgram per kg per day, equivalent to a starting dose of 50 micrograms in many newborns, have been recommended. Optimal care includes diagnosis before age 10 to 13 days and normalization of thyroid hormone blood levels by age 3 weeks. Prognosis. No physical and cognitive deficits if treatment is started in the neonatal period. The untreated disease is associated with neurocognitive dysfunction, example, decreased intelligence quotient. In summary, congenital hypothyroidism is a preventable cause of intellectual disability associated with various clinical manifestations. Treatment with levothyroxine by age 2 weeks can normalize cognitive and physical development. Therefore, newborn screening for congenital hypothyroidism plays an important role.